Michelle, wake up.
Yeah, Mom?
Are you okay? I heard you coughing.
It's so hot in here and my throat hurts. It feels like it's closing up.
Well, we're going to the doctor tomorrow.
Okay, well, I'm gonna go back to sleep.
All right, night.
Night, Mom.
Don't worry, sweetie, you won't feel a thing.
Yeah, I'm not really worried. I'll be fine. Mom, can you make those cookies? The ones with the cool shapes?
Yeah, I'll have them done by the time you get out of surgery.
Hello, Mrs. Lilsdane. We're ready to perform the surgery. You'll have to wait here, but we'll take you back now.
Love you.
Bye.
Good luck.
You.
How are you feeling?
My chest hurts and my lungs are on fire.
All right, I'm going to go to the doctor. Doctor! My daughter, she's having some chest pain. I don't know if that's normal.
Miss Lilsdane, I just looked at the results, and I'm afraid I have bad news. Your daughter's transplant was unsuccessful. Her body's rejecting the transplant lung. There's a high risk at this point that it may end fatally. Miss Lilsdane, Michelle's in very bad condition. You may want to go say a few last words. I'm sorry.
Sounds like I have cystic fibrosis. Is your skin salty?
Yeah, Mom, it is.
It's okay, we'll go to the doctor tomorrow.
So you did get the immune-reactive trypsinogen test that we use on infants for Rachel when she was a newborn?
Yeah, we did, but it didn't show anything then.
We will use that test so we can find out as soon as possible and get them treated for it, because Rachel may have cystic fibrosis now later in life. The case should be milder. We try to find the disease as soon as possible, as most cases are found between infancy and age 2. We will perform the most common used test nowadays, which is the sweat test, which was developed in 1950 by Dr. Paul D. St. Agnes. This test is used to see if the level of salt is unnaturally high.
My first daughter passed away a few years ago from this disease after a lung transplant that was unsuccessful, so I should know more about the disease, but I don't.
Well, I'm sorry to hear about your daughter. Cystic fibrosis is an inherited disease of your secretory glands, including the glands that make mucus and sweat. Both parents must have one cystic fibrosis defect gene to pass on to the child because the disease is only shown with 2 of the defected cystic fibrosis genes. The cause of the disease is a defect in the gene called cystic fibrosis transmembrane conductance regulator, or the CFTR gene. The unaffected gene makes a protein that controls the movement of salt and water in and out of the cells in your body. The unaffected gene keeps the linings of certain organs moist and prevents them from drying out or getting infected. It also keeps the mucus slippery and watery, but with the defected gene it causes thick, sticky mucus that builds up in the lungs and blocks airways. It also makes bacteria easier to grow with the buildup of mucus. It causes very salty sweat. This disease affects the lungs, pancreas, liver, intestines, sinuses, and sex organs. This disease affects the pancreas and stops natural enzymes from helping the body break down and absorb foods.
Oh my, that's a lot. What symptoms can we expect to see?
Well, for an infant, there is a lack of bowel movement in the first 24 to 48 hours of life. You're most likely to first see symptoms during infancy. More symptoms are salty skin, coughing, increased mucus in lungs or throat, fatigue, congestion in the nose, or repeating cases of pneumonia.
So when can we test Rachel for it? I've seen most of the symptoms you've mentioned, and I'm afraid that my worst nightmares come true.
We will perform the test right now, Miss Lilsdane.
Hello, doctor. What are the results showing?
I'm sorry, Miss Lilsdane. I'm afraid that Rachel did indeed inherit the gene from both you and your ex-husband. Her salt level is abnormally high. There are a few treatment options.
Well, it isn't too severe, is it, doctor?
No, we can use antibiotics to start with in pill forms or through veins with a breathing treatment. Breathing techniques may include the 4-expiration technique, FET, which is forcing out a couple of breaths and then doing relaxed breathing or active cycle breathing, ACB, which is FET, with deep breathing exercises that can loosen the mucus in your lungs and help open your airways. There are more options such as DNA enzyme therapy or chest physical therapy, also often referred to as postural drainage because it requires you to be sitting or lying on your stomach with your head down while you do chest physical therapy. This allows gravity to help drain the mucus from your lung. This can be hard or uncomfortable for some people, but several helpful devices have been developed, like an inflatable therapy vest that uses high-frequency airways to force the mucus out of your lungs, or a flutter device, which is a small handheld device through which you breathe out. It causes vibrations that dislodge the mucus. Also, a positive expiratory pressure mass that creates vibrations. This helps to help the mucus break from the airway walls. One of the last options is aerobic exercise that will loosen the mucus and encourage coughing to clear the mucus and improve your current overall condition. This treatment was founded by Dr. Schwarzman, which promotes active early treatment and proper nutrition. But as I'm sure you already know, Ms. Lowsdane, there is no cure for cystic fibrosis.
Right. Thank you, doctor. Do these treatments work well?
These are the most recent treatments we have found, and they are very effective and safe. The only possible side effects are with the lungs transplants for severe cases.
I did not see that coming.
Okay, listen, Rachel. These problems you've been having with breathing, they have an explanation. You're one of 1,000 people every year diagnosed with a disease called cystic fibrosis. That's what Michelle had. We found out when she was a baby that she had cystic fibrosis. That case was worse. It was more severe. Yours is more mild. The doctor is putting you on antibiotics that will do some chest physical therapy to help you. Don't be scared. You're going to be alright. "30,000 people in America are affected by cystic fibrosis. Males and females, 10 million Americans carry the disease. Most common in Caucasians, Northern European descent, Latinos, Native Americans. Not as common in Africans and Asians. More common in Central and Northwest Europe. Most common life-threatening inherited disease among Caucasians."
So are you worried about the cost?
I'll do anything for Rachel, but it can be really expensive. I saw online that the average cost is $13,000. For people with mild case, it ranges from $6,000 to $40,000 for people with a severe case, and that's annually.
That's insane. Will you be okay?
I'll be fine. I'm just worried about Rachel.
I understand. What else did you find out about it?
Well, I learned that the first clear description of the disease is in 1938. Dr. Dorothy Anderson was the doctor to discover and give the definition and description of it. The discovery was the defective gene was in 1989, though.
Wow, well, I wish the best for you and Rachel.
Thank you. We're leaving for the clinical trials tomorrow. Rachel's going to take some part in some of the most current research going on. We're going to the clinical trial to test potential new antibiotics and therapies to see how well they work. This is a major part of the research and will hopefully help find a cure. Good luck. Alright, Rachel, are you ready?
Yeah, Mom. Is this going to help me get better?
I hope so. Right now, because of all the treatments we currently have, people with the disease can expect to live into their 40s and beyond. But doctors can only ease the symptoms of it, and it's slow the progress. We're lucky the treatments have come this far. In the 1950s, children weren't even expected to live into elementary school, but there have been great advancements since then. Thanks to the Cystic Fibrosis Foundation. They're the ones leading the research and treatments for many years. They're the people we are now going to see for the clinical trials. Hopefully we'll help find a cure.
I hope so too.
Help the mucus break from the airway walls. One of the last options is aerobic exercise that will loosen the mucus and encourage coughing to clear the mucus and improve your current overall condition. This treatment was founded by Dr. Schwartzman, which
I want the cat.
That should have happened. Oh, paw on the belly button. Paw on the belly button.
Oh, that's weird.
get down.
No, sorry. Oh, you got that face in there.
Did you see my face?
I was going like this.
Did you see my
Beautiful. I'm filming. But thanks. I try when I'm about to freaking die. Hello. Well, yeah, because I get on the couch. Stop it!
Get on the couch. How are you feeling?
My chest hurts. My lungs feel like they're on fire.
I'll call the doctor. Doctor! How are you feeling?
My chest hurts. My lungs feel like they're on fire.
Haley, you just had surgery. You are not going to be moving your legs.
Hold on.
Put them down. Because I knew if I had surgery, I would definitely not be pulling my legs up to my chest.
How are you feeling? You look pretty good. You're gonna die. Tomorrow. Wait, guys, I just realized the script doesn't make any sense.
What?
Because we take Rebecca to the doctor. No, never mind. Never mind. Stop the video.
You know what?
My kid's dead.
The end!
Have a good life.
Reject.
Come back here. I'm not putting these clothes on tomorrow, so we gotta get this done now.
No.
I wonder if my pants are dry.
Megan, I got that.
Oh, God.
Dry?
I hope our biology class enjoys it.
It's still recording, honey.
Only ease the symptoms of it and slow the. Don't worry, honey. He'll be fine.
I'm not really worried. I'll be okay.